So if you don't want to show your face, you can block yourself. Close the camera. So vaccine for seniors, we have a special guest, Dr. Latif Morshid, and can I show me the another one?
You can read it, Mercedes.
Okay. So Dr. Latif is a family and ER physician based at SCHC. Dr. Murshi is the founder of the widely acclaimed Health Facts Clinic, a groundbreaking initiative that addresses vaccine hesitation through physician-led phone conversation and has now broadened its scope to include cancer screening, medication, and managed chronic pain, and so on. His work with Health Facts Plus has garnered national media attention and serves as a blueprint for engaging community in health literacy. Dr. Murshi is a lecturer at the University of Toronto, where he has created a novel health equity curriculum for resident physicians based on the tenets of experimental and transformative pedagogy. He is the founder of a non-profit organization called Stand Up for Health, which delivers immersive learning experiences to train healthcare workers in health equity and advocacy. That night, Dr. Murshi showcased his artistic flair as the lead vocalist of the indie alt-rock band Parachute Thief. Please help me to welcome Dr. Latif. Your floor is yours when you are ready, Doctor.
Thank you so much, Mercedes. Dr. Latif, the floor is yours.
Okay, thank you, Mercedes and Hannah, and thanks for everyone joining today. So I'm Dr. Murji, and so I'm going to now share my slides for our presentation. Okay, done this many times, but it's always slightly tricky. All right. We got some familiar faces in the crowd today. Love to see it. Okay, I want to share a portion of my screen.
Yeah.
Yeah, you.
By the way, Happy New Year, Dr. Latif.
Yes, happy 2026 to everyone. It's going to be a great year. Okay, how's that looking? Can you see my screen?
Yeah.
Yes, perfectly.
All right, so we can begin then. Okay. So this this presentation is titled "Vaccines for Healthy Aging." I didn't want to call it "Vaccines for Seniors" because we already know that we want to attain healthy aging, right? Where this is our goal. So let's think about aging in a healthy way as we move forward in 2026 and beyond. You'll see this logo for VaxFacts Plus. This is also known as Health Facts. And this is part of SCHC, Scarborough Center for Healthy Communities, and also SHN. So we have a partnership with the hospital, and that's how we're able to see anyone in the community and across the province. And we'll talk more about this, but basically you can speak one-on-one with the physician, that would be me, about any questions you have about your health, which often includes vaccination, but it can also include any questions about your medication or cancer screening, these kinds of things. And I'm happy to review these topics with you. So today we're going to talk about vaccines that many of you are eligible for and hopefully have already had, but if not, then we'll fill in the gaps, and we're also going to share the knowledge so that you can help empower the communities around you. And then we're going to have a question and answer period at the end, okay? So why are we even doing this? Well, we know that as we age, we have more infections. Our immune systems are weaker. We have less physiologic reserve, which means that it's a bit harder to bounce back. And that means that recovery can take a while. And that if you're in the hospital or if you're in a bed for a while, you're not moving that much. And that's called being deconditioned. So then once you get up and moving again, it's harder to do basically everything that you used to do. So the best thing to do is to prevent the infection. And one of the best ways for us to prevent infection is vaccination, as well as washing hands, and getting good rest and eating well and exercising, all the usual things. But vaccines are one of these really simple interventions that we have in medicine that do so much good, and they're safe and effective. All right, so that's why we're talking about it. So as I mentioned, as you get older, your immune system is weaker. This is natural, and the vaccines can actually boost your immune activation against certain types of viruses, for example, or bacteria, and that way you can be protected against them. And we know that different people have different responses in their immune system to vaccines, and particularly as you get older, your immune response is not as robust. It's not as excitable, let's say. And that's why we even give higher doses of vaccines to people once they're a certain age. Because the point of these vaccines is to stimulate your immune system, for your immune system to produce antibodies, which are soldiers that protect your body from an invader, such as a bacteria or virus. And that way you have all these soldiers ready. You have this whole army built up that knows this one enemy, and when that enemy shows up in reality, then your whole army and all your soldiers are prepared to fight it, because of the fact that you've prepared them with the vaccine. Okay, and you have this big army built up. Okay, so how the recommendations for vaccines work is not so straightforward. So that's why I wanted to review this with you. Because in Canada, we have this thing called NACI, okay? So this is the National Advisory Committee on Immunizations. So this is a group of expert doctors that make recommendations about which vaccines people in different situations should receive based off of their age and their comorbidities, which means the different types of diseases they might have already. So they look at all the science, all the evidence, and then they make these recommendations. And then the Ministry of Health in Ontario or different provinces look at that, and then they decide what they will fund publicly. So it's possible for something to be recommended, but then it's not funded. Or let's say some vaccine is recommended for anyone over age 50, but then Ontario will fund that vaccine for people who are age 60 or 65 and up, which means that there's people in between who are recommended to get it, but then it's not funded for them, which means it's not free for them. So that means that they would have to pay out of pocket. And the reason why this happens sometimes is because the government doesn't have infinite amount of funding, so they want to try to get the most bang for their buck. So maybe, in the example I used, maybe after age 60, then the disease rate of this, of something goes really high. So that's why they want to cover or publicly fund a vaccine after age 60, even though it's recommended after age 50, right? So they have reasons for what they do, but what we should try to do is get the recommended vaccines as soon as we can. And it all depends on your own risk factors and your age and your health. So we're going to review the basics today, but if you have any specific questions about your health and your medical conditions and your medications, etc., it's best to talk to a doctor one-on-one, and I'm happy to do that in an appointment later. Okay, so there's 4 big vaccines for seniors. There's other vaccines too, but these are the 4 that I really want to make sure that you have front of mind. So there's the flu shot, the COVID shot, RSV, and the pneumococcal shot. Okay? So I hope you all have these recently. Let's go into them. So
Actually, I got the first two, the flu and the COVID, but the other two I did not get.
okay. So that's why we're here, right? So we have, we have room for improvement, right? And this is something we can talk about after the presentation. Okay? As I mentioned, these are the big four, okay? So we're going to talk about each one now. So the flu vaccine is probably the most, famous one that you've heard of. This is a seasonal vaccine, and the flu is a seasonal virus. So every single year, the virus changes, it evolves, it mutates, and that's why the vaccine that we need also needs to be updated. And basically, the people who make the vaccine, right, there's all these scientists working, and they're looking at what type of flu virus is affecting people in places like Australia, on the other side of the world, where they have winter when we have summer. So their flu season is the opposite of ours. So we can look at what's going on there, and it can give us an idea of what type of virus we might be seeing in North America, and that might be infecting our population. So then they design a vaccine that works against that type of virus. And that's almost like a guess of what will be the flu virus circulating in the coming fall. And so that's how they create it, right? Because they can't just make a vaccine on the spot. So they take a guess based off of the information they have, and usually the guess is pretty good. So even if it's not a perfect match, you still get around 40% protection, which means like a decrease of your risk of the flu by that amount. And that's very important because seniors often die from the flu. I have actually seen a patient last month who, when I was working in the emergency department in a certain town, came in with, like, they were very sick and they ended up having the flu, and they were very, very, very sick. So this is not this is the thing that we want to prevent, right? So we want to make sure that everyone gets the flu shot, because the flu shot lowers your risk of getting the flu and getting sick. We have a special high dose version of the flu shot for seniors. And I know it's January now, so the flu season is usually from second half of October up till April. So it's still not too late to get the vaccine, and I would recommend anyone who doesn't have it to get it now. But ideally, you get the flu shot in October, right when it comes out. Okay, the next vaccine is the COVID vaccine. So COVID hasn't disappeared. It's still around. It's just not in the news as much. And the vaccine still lowers your risk of COVID. And I think that's important to lower your risk of COVID, because people get sick with COVID still. And especially if you're older and you have other diseases and you have problems with your lungs, for example, the COVID virus could actually really affect you. And even for other people, like, there's still long haul COVID syndrome, which even if you don't get that sick from COVID, you'd rather prevent it, because then you wouldn't get long haul COVID syndrome where you could feel tired or headaches and run down for months at a time. No one wants that, right? So for people who are aged 65 and up, there's a strong recommendation from NACI to get the COVID vaccine. And so I would say for you to go ahead and do that. Right now, there is a new updated vaccine. It also came out in the fall. So there's the Pfizer and Moderna, and it's for the latest Omicron variant, which is LP81. And all that means is that just like the flu vaccine, they're kind of updating the COVID vaccine as it evolves and as it mutates. And I would recommend that everyone get their COVID vaccine as well. And you can get this at the same time as your flu vaccine. So if you haven't had either, you can go in today and get them both. Okay, the next one, RSV vaccine. So RSV, what is this? I gave a talk about this recently. It's respiratory syncytial virus. And as I mentioned last time, I'll remind you that RSV affects very young babies, but it also affects people who are older adults. And this is a very common cause of pneumonia, and we have a vaccine for it, which we didn't always have. So this could really lower your risk of RSV and lower your risk of hospitalization and ICU admission and all these kinds of outcomes that we want to avoid. So it's a single dose. And as I mentioned, this publicly funded idea, this is publicly funded if you're 75 and older. And if you have medical conditions and you're from 60 to 74, it can also be publicly funded. But if you are totally healthy and you're 60 years old, you can still get it, but you'd have to pay out of pocket as it stands right now. That could change, right? The government could choose to publicly fund it later. But as of right now, if you are healthy, you have to pay out of pocket. And if you're 75 and older, it is publicly funded, so it's free. And if you have medical conditions and are over 60 years old, then you can get it for free. So that's the state of RSV vaccination, and I would recommend that you get that. And it's only one dose. So you don't need to get it every year or every season the way that you do for flu and COVID. Currently, the guidelines as they stand are that you get it once. But again, all of these guidelines are made by bodies that are reviewing evidence constantly. So that's what we are going to be continuing to look at, and these things might change in the future. Okay, and then the fourth out of the big four is the pneumonia vaccine, also known as the pneumococcal vaccine, because the pneumococcal bacteria is what causes pneumonia and meningitis and bloodstream infections. So those are very serious bacterial infections that we really want to avoid because you can die from that. And this is a routine vaccine. It's one time, and you get it once you turn 65. So if you have not had this, you definitely need this. If you're 65 and up, it's publicly funded. That means it's free. And a lot of people forget to do this because it's just not like as well known, possibly because it's only one time rather than the flu vaccine where you hear about it every fall. So make sure you get this if you haven't gotten it yet. Okay, the pneumococcal vaccine. Okay, so we're done with the big four. So let's talk about some other vaccines, because luckily there's more. So the shingles vaccine prevents shingles. And you might have heard of shingles. This is a reactivation of the chickenpox virus. So if you've had chickenpox when you're a kid, for example, when you get better, the virus doesn't actually go away completely. It actually lays dormant inside your body. And then one day, it opportunistically reemerges. So it just kind of comes back out, usually along a nerve, like one distribution of a nerve. So it's like there's like one side of this one patch of your body, maybe along your back or your chest or somewhere, where you end up seeing this rash. And there's vesicles, and it's red, and it's very, very painful. It could also be a bit itchy. But people have a lot of pain from shingles, and even after it goes away, you can continue to have pain, very bad pain for years. And we call it neuropathic pain because it's like a nerve pain. So we can avoid all of that by getting the vaccine, right? So it lowers your risk of shingles. And for kids these days, there's even a chickenpox vaccine, which would prevent this entire thing. But, if you're a senior right now, that means that you wouldn't be able to get the chickenpox vaccine because they created it not too long ago. So this is the vaccine for you, the shingles vaccine. And it's free if you're between 65 and 70. And if you are 50 and up, it's recommended. So for those who are, let's say, 53 years old, you would have to pay out of pocket, but I would still recommend that you do so if you can, because you might as well get protected against this painful disease, because I'd much rather pay than have the pain of shingles. Okay, then there's Tdap, tetanus, diphtheria, and acellular pertussis. So this is a vaccine that maybe sounds a bit weird to you, but it's probably the vaccine that you've had the most times already. When we see babies and kids, we give this vaccine to them many times because it needs a lot of boosters. Whoever's had like a tetanus shot booster, often you get this version of it. Sometimes they make a version that's just tetanus or tetanus and diphtheria, but this is Tdap, and it also has the acellular pertussis, which is also known as the whooping cough. And we need to boost this vaccine every 10 years because after 10 years, your immunity wanes, so it goes away. So it's important to just make sure you get in for your booster every 10 years. And that's why we have vaccine records, because it's hard to remember what you got 10 years ago or even longer, right? The other thing that we notice is that like some people go into the emergency department because they got a cut or whatever. And when we're working in the ER, we look or we ask the patient, we said, when was your last tetanus booster or your Tdap booster? And then they often say, I have no idea. Maybe it was 20 years ago, or maybe it was 15 years ago, or maybe they're like, oh yeah, I got that like a year ago. So if we think that it's been more than 10 years, or if we know it's been more than 10 years, then we will just immunize them right on the spot with Tdap. But there's a lot of people who don't get a cut and show up in the ER. And if you don't, then you wouldn't have had this updated. So it's important you try to just have good records for yourself and take your health care in your own hands and make sure that you get this vaccine for yourself, because a lot of you might already be overdue and not realize that. Okay, so what about any other vaccines that you might need? Well, it depends. It depends. Depends on your own health. It depends on where you might be traveling, what you're exposed to, and what medical conditions you might have. So I'm not going to give generic advice because everyone needs specific advice for their own situation. And so that's why what we always recommend is you speak to your provider. So that could be your family doctor, nurse practitioner, or it could be me at the VaxFax clinic. So I encourage you to do that. And then we talked about this a little bit, but in Ontario, there's a lot of stuff that's publicly funded, but there's some things that are not. It depends how old you are, right? As I mentioned, for shingles, for example, if you're in your 50s, it's recommended to get the shingles vaccine, but it's not funded. But then if you wait till you're, this is RSV. If you wait till you're 65, then it is covered. But then if you're over 70, it's not again, right? So your age window matters. So it's good to know this information so that you can plan for when you're going to get certain vaccines if it matters to you to get it publicly funded. Otherwise, if you're willing to pay out of pocket, then you might as well go ahead and just get it right away. And then also, if you have like certain private insurance, then you can also possibly get that to pay for a vaccine if it is not already covered by the Ontario government. Okay, so now where do you even get vaccines? Well, luckily, you can get them in a lot of places. So your family doctor will have vaccines. Pharmacies have a lot of vaccines now, and the pharmacists are now eligible or able to immunize you. Community clinics like SCHC will have a lot of vaccines. And you might remember there's like this yellow card. It's your vaccine record. I would recommend that you bring that with you everywhere you go for anytime you're getting a vaccine. And maybe even take a picture of it and keep it in your phone. Because this is a good way to document the vaccines that you get, and that way you have a record that is moving around with you. And if you ever go to a new doctor or you go to the hospital, you can show them your vaccination history, and then that will help them understand your level of risk and the amount of, the different types of treatments that you've received or vaccines. Okay, so now we're going to move into questions in a second, but I just want to answer some that I anticipate that you will ask, because these are some questions that I hear all the time. Sometimes people say, I never get sick. Why should I get this vaccine? Well, that's great that you never get sick. That doesn't mean that you never will get sick. So the point of vaccines is to prevent illness and to prevent infection. So it's not going to harm you. We know these vaccines are very safe, and you don't want to be the person who is very, very sick and then regrets not getting a vaccine because you're sick with something that was preventable. Some people are kind of concerned about the fact that there's many vaccines. They might feel like there's too many. Maybe it's hard to keep up with, or maybe it's annoying to do it, or maybe they're scared of getting the shot. Well, I do agree that there's now more vaccines than there used to be, and this is actually a great thing. Like, I'm grateful that there's more vaccines because now we're more protected. Vaccination is the best way you can stay safe. It's much better than getting the actual infection. So I'd much rather take the vaccine over an infection, and you can actually get a lot of these vaccines at the same time, so that makes it much more convenient. There's no harm to doing that. We call it co-administration, and as of now, almost all the vaccines that we've talked about are safe for co-administration, and if you ever have questions about that, you can ask. So I would say that there are not too many vaccines, and in fact, I would welcome more for other infections that we might not have a vaccine for yet. And we still we want to be as healthy as we can, right? So prevention is much better than treatment. Regarding side effects, I've talked about this before, but the typical side effects from vaccines are a sore arm, maybe a fever, maybe a bit of headache or nausea, this kind of thing. And usually these last 1 to 3 days, and they are transient, so they don't last forever. It goes away. These are actually signs that your immune system is being activated, which is a good thing, which is what we want. And usually if you take Tylenol or Advil, your symptoms improve significantly and you'll feel better pretty soon. And again, you have to compare these things, these side effects, which are not actually that common, to the contrast that to getting the infection itself, which would be much worse. So it's definitely worth doing. And then in terms of safety, as I mentioned, these are very safe vaccinations. They've been used for years and years and by millions and sometimes billions of people. So we have a ton of data and know that they are safe and that they're effective. If they were safe but not effective, or if they were effective but not safe, we would not be giving them. And there have been other vaccines or treatments that were safe but ineffective, or effective but not safe, and we're not receiving those right now because they don't make it. We wouldn't be giving it if it was not both safe and effective. So Health Canada does a good job of being super thorough. Like, they look through hundreds and hundreds of pages of data on the people who first get the vaccines in the trials, and then only after this group of doctors and scientists convenes and reviews everything under a fine-tooth comb, once they feel comfortable with the safety, that's only when it gets approved. So I feel comfortable getting these vaccines because I know that they've been tested and they're very safe. Okay, so key take-home messages for you. Vaccines are good for you. They keep you healthy, which means they protect your independence as a senior. An ounce of prevention is worth a pound of cure. So let's prevent the infections. Let's prevent the sicknesses so that we don't have to deal with the recovery, because recoveries can be very difficult. And based off of your age, there's different recommendations. So it's good to know what's going on so you can anticipate what you might become eligible for in the future. And it's important to have a close relationship with your family doctor so that you can know what's coming up as well. And asking questions, attending these kind of sessions today is really good because you're staying informed and you're on top of your own health. So now it's time for me to answer your questions. If you have any, feel free to ask anything you want. But as I said, if it's about your own personal health or your medications, that kind of thing, I would recommend that you talk to me about that in private at an appointment with the Health Facts Clinic. And the way to book an appointment is right here on this link. And I can put this in the chat as well so that you can just click it and access it through that. So thank you very much. Oh yeah, and I don't know if I mentioned the details around this, but basically you click on this link to book an appointment, and then you can pick a day and a time that works for you, and then I will call you, and it will be a unknown or private number, and then we will have a phone call about any questions that you have about your health. And that way it's in private, which I know a lot of, it's very important for healthcare. So without further ado, I'm happy to take your questions. Thank you.
Thank you, Dr. Latif, for your amazing presentation. And I really like because the language that you use is very understandable, no medical word, so it's easy for the community understand. We have a question here from Katie. Would you suggest boosting with the Tdap versus TD, even if they have the one adult dose of Tdap?
Yeah, I'd have to double check when that dose was, but I'm pretty sure you just need one adult dose of Tdap. Like I know in pregnancy you definitely need another Tdap dose because of the pertussis. But you're an NP, so I can talk about this offline. We can dive deep into the recommendations, but I'm pretty sure once you have an adult dose of Tdap, then you are good for Tdap for quite a while.
Also, Kitty has another comment. In your experience, when clients come to vaccination clinics with vaccine record for different countries requiring translation, do you, as a MRP vaccination prescriber, translate the information and they write it on a new yellow card? Or do you just document the vaccination, you prescribe it on the yellow card, or you run it to the issue at my first vaccination clinic and legally it made me feel uneasy?
Yeah, this is a medical legal question. So technically I can't advise on this because I guess this is medical legal, but from what I would do is generally, and this is not legal advice, is if I feel pretty confident that this is like a real vaccination record from another country and that I can understand what it says, and if everything is seeming real and it's all adding up and everything is legit, then I do think that it's okay to create a new yellow card, because if they're coming to Canada and Ontario and they're here to stay, they need that, and it would be very helpful for them to have their vaccines written down in English and dated and signed by a health professional, and someone's got to do it. So I try to do that, or you can write a letter that summarizes it all, but then eventually someone's going to have to turn that into a yellow card and put it down. It's possible that in the future the yellow card is not going to be the standard, and that maybe there's a new way of Ontario keeping track of vaccines, if potentially an online database. But I do think it's really important to have good vaccination records, and we have a good system, and it's helpful to put it down for them.
I can share my experience when we are supporting the clinic doctor. The nurses just to give a note, proof of the vaccination in the moment, and they tell parents to keep the yellow card or the color of the card their country. And when they have a family doctor or NP, the secretary can do this job because sometimes during the clinic is a lot. So and also the city of Toronto, they give a yellow card. Sometimes we give a yellow card if we have it, sometimes just a proof of the vaccination. But it's a good recommendation to have the yellow card. I don't have it. So maybe it's time to get one. I have all the vaccines, but I don't have the yellow card.
Yeah,
Thank
everyone
you
should
so
have it.
much. Hmm?
It's important for everyone to have vaccination records and to have a
Hmm.
yellow card. And it like make sure when you give someone a yellow card, like tell them that it's extremely important and for them to always have it when they see any doctor or medical practitioner. Because
Hmm.
the last thing you want is for them to lose it or they like don't bring it and then you end up making another one. Now they have two or three yellow cards with different vaccine information on them and
Hmm.
then it's so confusing. So yeah, once they get it, like it's this like responsibility that they are the
Hmm.
custodian of their own vaccination record.
Also, for people who has a family doctor or NP like a regular basis, they can inform them so they can put in the profile that they get the vaccines. It's another way to have the record, no?
Yeah, you like if you are a patient at a CHC, for example, we use PSS, so we have an EMR, electronic medical record.
Mm.
Every doctor basically is using an electronic medical record when they're seeing the patient. But the thing that patients don't realize is that the electronic medical records in one place don't necessarily communicate with the next
The
electronic
rest.
medical record.
Mm.
So it's not like if I was the patient, I wouldn't just trust the vaccine record to be taken care of by the healthcare provider because that's not actually the way that we do it in Ontario. It's it's the record is kept by providers, but or it's supposed to be kept by providers when they administer a vaccine. However, the overall vaccine record is kept by the patient, and this is
Mm.
different than everything else. Like I don't have like me as a patient, okay? I don't have like a record of like every doctor's appointment I've been to. Like I don't have that, but my doctor has that. But I do have a yellow card and it has
A
all the
vaccine.
vaccines I've ever had in my whole life, whether it's been with my family doctor or whether it was in school or like at a random like public health clinic or at a travel clinic or at a COVID clinic, for example. I'm the one who has those records. So vaccine records, the way we do it in Ontario is that the patient is the one who holds the records. Whereas
Mm.
for all the other health records, the provider holds the records.
Perfect. Thank you so much. Very clear. So let's talking again about the vaccine record. What happened if we came to this country and they don't have any record, but because just because they don't have it? So what is the approach in this
Yeah, it's
situation?
tricky because then we have no proof that they have any vaccines. So then we might have to just start from scratch. So there's something called a catch up schedule for vaccines. So we would use that and we would give that patient certain vaccines depending on their age and their risk factors. We would give them certain vaccines to catch them up because we would have to assume that they've had no vaccines ever.
Mm.
I see that Katie is asking if it's
Yeah,
dangerous to revaccinate if the patients have had it before and no record. So, no, it's not. Uh,
perfect, clear.
like, if you, like, let's say someone got all their vaccines in country X and then now they're coming here to Canada and they have no records of anything ever, and they forgot that they even had any vaccines, and then you caught them up with everything, that's totally fine. Nothing bad will happen to them.
Okay. Well, I have another question because people were sending question. So for example, if I going to under chemo treatment, it's okay to get the vaccine?
Yes, almost all the vaccines should be safe, but there are certain vaccines that are live vaccines that might not be appropriate. So, and then there's different types of chemotherapy, right? So this is a question that before you get any vaccine or you decide any which way, I would book an appointment with me at the VaxFax clinic, and we can talk about that, and we can make sure that we know everything that's going on and make the right choice.
So I have to get the shingles vaccine even if I had shingles?
No one has to do anything, but yes, I would recommend that even if you had shingles, you would still benefit from the vaccine because it would lower your chance of getting shingles again. And we want to lower people's risk, right? That's the whole point.
Is there any specific recommendation for a specific vaccine when we are thinking to travel to some countries?
Yes, so for travel vaccines, this is like a whole subspecialty. So it depends on where in the world you're going and which, like, if you're in rural areas or urban areas, right, there's all kinds of different diseases that you might be exposed to. Like, there's things like yellow fever, um, like, there's all kinds of diseases that are not, that we don't really deal with in Canada, right? Even like hepatitis A, for example, you don't really get that in Canada. So we don't routinely vaccinate against that. But if you're traveling to certain places, then it does become recommended. So that's all depending on where you're going, your risk factors, like what diseases are like endemic to that region, which means like what diseases are around that area. So those are what we would be talking about. So that would be again a one-on-one consultation.
Oh, perfect. So, do we expect one shot for both COVID and flu vaccine soon, or we any news about that?
Yeah, we've been talking about this for like a few years now, right? So I wouldn't bet on it happening soon because it's kind of like the Eglinton LRT. It like they say it's coming and then it never happens. So uh, I would bet that it doesn't happen next year. Just, it's kind of like the Leafs winning the Stanley Cup. Like people think it's going to happen and then it reliably doesn't happen.
Okay, perfect example. Thank you so much.
But it's a good idea, and it would be cool to have them in the
Yeah.
same shot because then it'll just simplify things and people will get one less poke and stuff like that. So hopefully it
Hmm.
happens one day, but don't count on it to happen soon.
So, and as a doctor, so you can recommend us, for example, I think in all the vaccines are getting an overwhelming my immune system. What is your recommendation? What is your thoughts about this thinking? Because sometimes we think, no, or also as a community ambassador, when I talk in the community and I try to explain what is the benefits of the vaccine. They say, no, no, I don't want it. It's too much. It's too much. I don't know. I have a good immune system.
Yeah, well, that's good that people feel like confident about their health, and we want them to feel like, I guess we want people to be like informed, right? That this is something that can prevent an infection, and it's kind of like going to the gym and exercising. Like if you go and exercise, you're actually strengthening your muscles and you're strengthening your heart. And then like you're prepared for, like, let's say if you have to play some sort of sport or you have to run away from the bad guy or something. But then if you don't prepare, right, you don't get the vaccine, then the threat comes, you have to run away from someone and they get you, right? So you might feel safe right now, but that's because you don't have the threat right now. So it's good to prepare and keep your body strong, keep your immune system strong, so that when the threat arrives, and remember these a lot of these things happen when you're a little bit older, but you want to keep your immune system strong. And today we're talking about healthy aging, right? So you don't want to have to be admitted to the hospital, because as I said, once you get admitted to the hospital, it might be the flu that makes you feel sick, and maybe you'll get better and you are back to normal. But if it takes you into the hospital and you spend a few days in the hospital and you're not walking around and then you get weaker and you might never come back to the way you were, and you have less reserve, and this kind of takes a toll on your body, and it's just, you never bounce back fully. So it's really important to prevent these things from happening, not only because then you don't have to experience the illness at all, but you also come out of it in a much like better position.
Okay, perfect. I don't know if it's any of the attendees have another question. If you know, I want to be mindful of the time. We are perfect, 5:59, perfect, the time. So if you have any question and you want to send me an email, I put my email there and you can ask me questions. And I think it's all for them. I want to say thank you so much for your time, Dr. Latif. It's always a pleasure to have you as a speaker. And thank you so much for all the attendees. And we're gonna put now the link for the um, poll, so the survey, so you can complete. If you feel comfortable, you can add your email address and you will participate of the gift card.
Yeah, thank you.
And
Thank
yes,
you so much, Dr. Latif. It was very informative presentation. Also, thank you for all the attendees. We have shared already our flyers about upcoming RSV vaccine clinics at SCHC. Also, we have shared the flyer of Health Facts Plus. It's very important to keep a copy in your records, because always there is a need to speak with a smart doctor like Dr. Latif. He is available almost 24/7, I can see. You can book an appointment with him anytime you're using this link, or maybe, as I said earlier, you can keep a copy of the flyer because it's already shared in the chat. Thank you so much, and it's just time to say thank you again, and you have the chance now to participate in the feedback form.
one more thing. The health facts, the thing is a great thing is that you don't feel comfortable talking in English, you can ask for translation in advance. When you book, you put that the language that you prefer. So we try to cover all the barriers so people can ask questions for our professional.
Yeah, we have over 200 languages
Yeah,
for live translation or interpretation.
yeah. Great. Thank you so
Thank you.
much. Have a good
Okay.
night.
Thank you.